Good evening, everybody. I am Edith Lozano. Today I'm going to talk about my project. I start talking about well-being. What is well-being? Well-being is not only the absence of illness. Well-being is a complex combination of person physical, emotional, mental, and social health factors. In other words, well-being could be described as how you feel about yourself or your life. Level of well-being in my country depends on many factors such as access to health, maternal mortality, mental health, life expectancy, nutrition, infants mortality, and COVID-19. The most important is access to health. Access to health in my country is not equal in all cities. For example, if we live in Huancavelica doesn't have enough hospital, especially in rural area, and the hospital doesn't have specialized doctors, and the doctor can treat many kinds of illness. But if you live in Lima, Lima has many hospitals, and the hospitals has specialized doctor, and the doctor cure some illness. If you need a surgery, the doctor can do this in these hospitals. And the doctor, in all the case, prescribes some medicine in order to feel better. Another kind of factor who improve the well-being is mortality, maternal mortality. In the 80s, the women gave birth at home. Nowadays, the women give birth at hospital. This activity decreases the mortality. The most common disease in my country are respiratory disease, gastrointestinal disease, chronic disease. These chronic disease include many illnesses such as cancer, cardiovascular disease, hypertension, diabetes mellitus, obesity. And other important, the people who get over COVID-19 infection now experience high levels of stress, and they feel bad and has depression or anxiety. The most common infection in my country are respiratory disease. It is frequently in children. The children have many kinds of symptoms like headache, fever. In some cases, they sore throat, they chest hard, and in some cases they can breathe very well. In all these cases, in the people, it's important visit to the hospital in order to the doctor prescribe some medicine. It's important treat the problem, not only the symptoms. It's not recommended to go to the drugstores because in this place doesn't have doctors. When you have a respiratory disease, it's important use mask, and also it's better fist bump than shake hands because in this way you can decrease the transmission of germs. Another is gastrointestinal disease. In this case, the people have headache, their stomach hurt, and in some cases, if the people don't drink enough water, they can complicate with dehydration. In all of these kind of illness, it's important visit to the hospital. Health of the people after the pandemic. Many of people who get sick with COVID-19 now and they get over this kind of illness, they experience many mental disorders like depression, post-traumatic disorder, or anxiety. My country is very beautiful. My country has many special tourist places in order to feel happy. If you are into adrenaline or adventure, this activity is for you. For the adventures, hiking and trekking is a good idea. You can do this activity in Machu Picchu. Water sport, there are a lot of places to do this activity. One of them are Cañete River, especially Lunawana. In this place you can practice rafting, but it's important to do how how to swim, because if you don't know, if you fall off the boat, you can injure some part of your body. Another is kayak, and if you can do sandboard, in this activity you can practice in Wakachina Island. And if you like culture, ancient, another activities exploring ancient ruins, it could be Machu Picchu, Sacsayhuaman, and others. You can do some cultural immersion, you can take some classes about cooking or dancing. And finally, if you are into nature, for nature lovers, this activities is very good. Wild spotting, you can do this activity in Paracas, or if you love the nature, you can visit the Amazon. A good idea is visit to Iquitos. And if you like the scenic beauty, you can view or show the Nazca lines. It's all very well. Thanks very much.